Hi, I'm Dr. Trevor Van Oostrom, one of the interventional pain physicians at Bloor Pain Specialists, and today we're going to be talking about common questions about pain medications.
Yes, in fact, we have around 20-something opioids that we can use for pain, and we have a couple hundred other medications from different classes of medications that we can use for pain.
It is so common. Almost everyone, seemingly everyone, thinks about opioids as the only pain medications. And interestingly, as we know more and more and more about the effects and side effects of opioids, we learn that really they're not very effective at all. When we look at large data sets, looking at very well done trials and then comparing them to other very well done trials and including all that data, just heaps and heaps of, thousands and thousands of patients, we can really track outcomes over time and not have a single story say, hey, my aunt, she feels better, or my neighbor's neighbor has a kid who took morphine and now feels better. Well, that's one case, and that could happen with everything and anything. Some people feel better with exercises. Others feel better with psychological interventions. Other people feel better with stretches, yoga, Pilates. Other people feel better with medications or procedures like radiofrequency ablations or epidural steroid injections, which we do here at Bloor Pain Specialists. But when it comes to the actual data, when we look at averages and we look at what most people end up feeling and how most people end up doing, the vast majority of people do very similarly between placebo and opioids, which is shocking to most to hear. And it really highlights how ineffective this class is.
So in general, we try and avoid taking opiates on a regular basis because people get tolerant. Over time, they may slip into addiction, and the long-term data does not support a great outcome with chronic use of opiates.
The other thing to keep in mind with opioids is if patients are on it for a long time as well, you can develop what's called opioid-induced hyperalgesia, which basically is an ill effect of it where you're taking it for too long, and instead of actually easing your pain, you actually can develop hypersensitivity, or your pain threshold will go down, so you feel pain all the more. And there have been studies for patients who have specifically fibromyalgia that they actually have an increased level of endogenous opioids, meaning their body's own opioid levels are increased. So, and that means, that opioids may have a role in terms of causing fibromyalgia. I'm not saying that is totally the case, but there may be an association. So giving an opioid medication or prescribing an opioid medication may possibly make that worse too.
Sometimes we'll rely on some of these atypical pain medications. One might call them nerve blockers. These would be things like gabapentin, Lyrica, even some of the antidepressants like amitriptyline, or you may have heard of a drug on the television called Cymbalta. These are antidepressants that can change the way your nervous system functions and alters the way you feel about the pain. And they're very safe to take on a long-term basis if you're not experiencing side effects. So unlike some of these other drugs like anti-inflammatories that are meant for short courses to avoid hurting one's kidneys or stomach, and opiates where one might get addicted or at least tolerant, these nervous system modulators, if you will, are meant to be taken for the rest of your life if you have to. We have lots of patients who may have seizures and they take anti-seizure medications for very long periods, or they have depression and they take their antidepressants for very long periods. And so we know they're safe for long periods of time as long as you're not getting side effects, and pain is no different.
Thank you for watching today's video. Please don't forget to like, comment, and subscribe. For questions about your care, please contact our clinic directly.